So good afternoon, everyone. We have with us today Dr. Vinay Deshpande, and before I introduce him, let me just start by talking a little bit about Patients Engage. As most of you who are listening in are aware, Patients Engage is an online platform for which we've been operational for about 5 years. We are focused on holistic and evidence-based management of chronic conditions from the perspective of patients and family caregivers. And we've believe in the value of lived experiences and how patients and the caregivers need to engage and be proactive about their own health issues. And that is what leads to better quality of life. We've been doing these monthly webinars for about 18 months. But given the current global COVID-19 pandemic, we found that people with chronic conditions have unique challenges and they've been struggling to manage. They also have a host of concerns. So we thought we would bring in experts who can help address these concerns. And we're starting the series today where we will talk to Dr. Vinay Deshpande. So let me just introduce him quickly. He's a surgical oncologist and a breast cancer consultant with Hinduja, Breach Candy, and Asian Cancer Institute. He's also the medical director and a trustee and joint secretary of the Indian Cancer Society. He works a lot on population registries of related to cancer as well. And I think because we have a short amount of time and we have a lot of questions, we will get started quickly. Just so that the audience knows, this session will be recorded, and you can post your questions on the live feed on Facebook, and you can follow us on our social pages or write to us at editor@patientsengage.com. So let me stop sharing and let's bring Dr. Vinay Deshpande. Doctor, the first question we are getting from people is, should people continue with cancer treatment during the period of lockdown?
Yeah, this is a difficult question because of each government or each country now has its own guidelines. But in general, yes, cancer treatment should be continued in consultation with your physician. Simply because if you delay treatment, you can get what we call stage migration. That means the stage of treatment cancer can increase. Or if you're already on drugs like chemotherapy and or radiation, if the treatment is not given according to schedule, then it has a chance of becoming ineffective. So it's quite
Right,
important that you try and continue with the treatment through this lockdown.
right, right. And currently, I know that most governments have, or a lot of them are looking at delaying elective surgeries and so on. So are most of them thinking of cancer surgeries and other treatment protocols as elective as well?
Yes, unfortunately, a lot of cancer surgery has been considered as elective, but actually it isn't. It's a semi-emergency. I mean, a lot of uh, unless there is a pressing, let's say, an obstruction or a perforation or something which is life-threatening, um, which are classical emergencies in general surgical uh, thought process or general medicine thought process. When it comes to oncology, tumors keep growing. So
Right.
they go slowly sometimes, and at a particular time in the life of a tumor, they start going faster. So it's important that these are considered semi-emergencies and should be triaged and taken up for appropriate treatment as soon as possible.
Okay. Thank you. Um, so the people going through chemo, they typically have their immunity compromised, or that's the perception. What precaution should they be taking?
Well, all patients do not have the immunity compromised. That's number one, and the immunity is not compromised all through treatment.
Hmm.
There are certain phases, especially if you get the standard chemotherapies, it's the second week when the immunity is compromised. So in general, anyway, you would take a lot of precaution during that period, which is literally like a lockdown, where you want to decrease your exposure.
Right.
But at the point of taking your chemotherapy, there is no immunity compromise. And if your immunity is compromised, anyway, the chemotherapy is not given. It's only
Mm.
if your counts are normal and generally well that somebody would give it. So you need to take the same precautions that you would do normally. And of course, monitoring has to be strict, and each consultant or your primary physician should be able to advise you about whether you can go through with your chemotherapy course or not.
Right.
But
Right.
but it's important to realize that everyone does not have a problem with chemotherapy.
Right.
But but there will be, after your first cycle or a second cycle, you actually know whether you're having any problems. You may change the drugs. They may appropriately monitor the doses. Uh, but you could go through chemotherapy during this period.
Right. Okay. Thank you.
And there is going to be a minority who will have a problem. And those we may have to stop chemotherapy altogether.
Right. And how can we practice social distancing while going for chemo?
Well, and in today's era, whether we like it or not, we have to practice social distance.
Mm.
And then during chemotherapy, there's no need not to practice social distancing, because when you are admitted, the hospital has to take care today about social distancing. So the hospital will take its appropriate care. The nurses and all will all be trained. There will be a
Right.
minimal number of attendants attending to you. And I think the normal Indian practice of bringing 2 and 3 people and 4 people accompanying a patient to a hospital is absolutely not necessary.
Mm.
So you can come with just one attendant to help you, and that I think that these are the ways you can do it. You
Right.
have to be practical, and I think there's no appropriate solution, but one has to become practical and in a given situation and do the best you can.
Right. And if I'm a patient going through chemo, what are the precautions I need to take at home?
Well, simple things. First of all, the minute you come home, you should just get rid of all your things. That means your shoes be removed outside. You should walk straight into the bathroom, throw everything for wash.
Mm.
Okay, put it into, if you have Dettol or one of the antiseptic things, put in water. Make sure all your clothes go into water. Wipe down all your things like belts and things which you've worn. Even
Right.
wallets, your purses, what you've carried, all those things have to be wiped down with a sanitizer,
Mm.
cleaned and kept. And preferably things which you're going to keep taking in and out of the house should be kept towards the door. You don't bring them in.
Right.
Have a proper bath, and then change into a completely new dress, and then come back into society. That means in your house. This will minimize the chances of others getting infected. And
Right.
make sure that your water has been boiled, your water is warm. Should make sure whatever food you're having is piping hot. During
Mm.
chemotherapy, generally we advise people not to have too spicy, not too oily food. Make
Right.
sure you have small quantities, not too large quantities, and be sensible in general about what you're having.
Right. Okay. And you know, there is also a lot of issues that people are having with transportation and so on, right? So um, I think there's feedback, Doctor, if you can speak a little louder.
Yes. Oh,
So,
sorry. Okay.
yeah.
Can
Okay.
you? Is that better?
Yeah, I think that's
Okay.
better. Okay.
All right.
So yeah, if because of issues of transportation, what happens if people miss a chemo cycle, uh, or is there an
Uh,
option to do it, to look for options closer to home?
well, yes. I mean, the first option should be to look at something closer to home, so you can get to the place and come back with minimal exposure, as little exposure as possible. That's one. If you miss one odd cycle or it gets delayed, that's not much of a problem.
Mm.
So very often chemotherapy cycles can get delayed, um, especially if your, let's say, your count is down, then you got to
Right.
wait for the count to come up. So a wait of a few days or a week is not such a big problem. Um, if you can, the other thing about transportation is, yes, you can drive and you can ask the doctors to give you a letter.
Mm.
For example, in Mumbai today, where I practice, I'm stopped every time I go to the hospital. So
Right.
I have to show my credentials that I'm a doctor going for work, and my
Correct.
patients who've been operated, I give their relatives a letter saying
Okay.
that they are accompanying so and so who's been operated, and so they have something to carry, which allows them, because these are considered essential services,
Right.
and as essential services, you can then go to a hospital. then
Right.
that just leaves the last bit is transportation, is whether you can get a taxi. And there's, I
Mm,
mean, these are sort of arrangement that one will have to do, because we know that regular cabs are not available in Bombay at the moment.
right.
So Uber and these are working at, you know, are not really working the way they should. So these are arrangements that one has to work
Right.
out.
Right. Right. And this, we discussed the effect of or how to handle chemo. Is it different for radiation or is it the same?
No, it's exactly the same. In fact, radiation does not really affect your immunity
Right.
unless you're getting abdominal radiation or something which prevents you from taking your intake. Uh, Radiation will not actually affect immunity to any large extent.
Right.
In fact, radiation does not have too many side effects. Of course, there are certain sites. If the internal sites, like the gastrointestinal system, that means esophagus or
Mm,
stomach or abdominal cavity, that's one place where you can get some symptoms.
right.
Head and neck radiation also can affect your swallowing. So these are areas which have to be really managed carefully. And in a situation like this, very well, but then that's what the radiation therapist is there for, to help you to tide over these things.
Right. Right. Okay. Um, Here's a question. Doctors have advised us to be extra careful. Are survivors of any specific site cancer, do they need to be more careful as well?
No, if you've survived cancer, then you're actually a normal person. I mean,
Right.
I personally don't even like the word survivor, because
Mm,
you are normal. If your cancer is controlled, you're a normal person. You're going to have, your immunity is going to be normal. You should be able to do all normal activity. So you have to take the normal, sensible precaution that any normal person would take.
right. Right. And if you have been told, or if you've heard that, the staff at the hospital that you go to has been tested positive, do I need to then look for another hospital, or how do I need to change my appointments? What would your advice be?
Well, in general, if anybody has been tested positive, any of the doctors or the service providers being tested positive, they have to be quarantined. They are not
Right.
going to be available to treat you. So there will be somebody else, and these are going to be normal people. And the whole problem about this particular flu is that even people who are normal can be carriers. So you
Right.
need to maintain the social distancing and and practice barrier nursing
Hmm.
when the treatments are being provided. And that's what every hospital should be doing in any case.
And I guess the point on that is not just the patient, but the family member, whoever is
Of
accompanying,
course.
should also be practicing social distancing
Absolutely.
while they're
Yes,
waiting outside and things like that.
that's right.
What happens? Here's a question. What happens if the targeted therapies get delayed in reaching because couriers are not reaching on time?
Well, as long as it's not a very long break, as I said, a few
Mm,
days here and there won't make a difference. But a long break, I mean, is not something we like. But if there is no option, I mean, we just have to go on with it, and
right,
hope for the best. So if
right.
you get a break for a few days, I think it will not make any difference. But the minute it goes, let's say, into 3 and 4 weeks, we are not sure how effective the treatments actually are, because everything, there's something called dosing, dose
Mm,
density.
mm,
That means doses have to be given at particular times.
right.
So if this density is lost, doesn't mean the treatment becomes ineffective. But we do not have the data to confidently say that it's going to give the same results as somebody who gets treatment at the right opportune time.
Mm,
But in a situation like this, with our backs to the wall, we must remember that when we are not in an ideal situation, we have to manage the best we can and then just go on.
right. Okay. Um, yeah. Regular paid caregivers are not available. In case a patient has no other caregiver, is there any service which provides help to such patients? Have you come across anything so far, doctor?
Well, there are now, I forget the names, but there are some online services which have come up. And I
Right.
think you've got to do these searches
Yeah.
for these caregivers, because you have these nursing bureaus. I know
Right.
that we've had nursing bureaus which send nurses over to look at someone at home for ages. I don't
Correct.
know how many are going to be available today, because everyone's going to be short staffed. People have
Right.
gone back even to their villages. So everyone is short staffed. But you've got to search, and there are now service providers,
Yeah, yeah. We
and
do
they like
have a slide after at the end of this where we'll talk through a couple of those things that we've come across. Um, I think one other question is, are there, side effects of treatment that can be mistaken for COVID symptoms? And what should someone do if there is a doubt?
Yeah, well, see, the thing to understand is COVID symptoms. Um, Basically, it's difficult to differentiate from regular flu.
Right.
So, but it says a dry cough and fever is very classical of COVID-19.
Hmm.
Um, but you can get a dry cough for various, even if you get allergy, you can get a dry cough.
Right.
So it's not everything, everybody who has a dry cough will necessarily have COVID-19.
Hmm.
And not everybody who has fever will have COVID-19. So if you look at both these symptoms separately, fever is so common in India, flus are so common. So you could have the common flu.
Right.
If something is not being shaken, if something is because you're feeling worse, I mean, this obviously requires evaluation.
Right.
And as soon as you realize that you may be having something, yes, you should get yourself evaluated. The only way to do it is really a nasal or throat swab. So you need to go to a hospital which does it. Or nowadays they have got so many of the private labs are advertising that they will send someone over home.
Right.
Uh, they do need to take down your particulars and take the swabs at home.
Right.
Until till you get the answer, you should then be in quarantine.
Okay.
But
Okay.
uh, most of cancer is not necessarily going to cause these symptoms. It's only if you're chemotherapy and you're getting immunocompromised and you're getting coughs and fevers because of that,
Hmm.
that it will get mixed up with these symptoms.
Okay.
The problem is when you are a cancer patient, um, there's a tendency for most cancer patients to attribute every symptom they have due to cancer. And it's
Right.
not really so. Especially
Right.
if your cancer is controlled, you have no symptoms. You're like a normal person. So
Right.
you will get the normal coughs and colds and fevers and diarrheas that normal people get. And in India, where we are now doing very well, but we must remember that infections are extremely common.
Right.
For example, TB is so common in our country, but all of us don't get infected with TB
Hmm.
because we have innate immunity. Similarly, against most of your flus, you will actually have some innate immunity. This is a new
Right.
virus, so the
Right.
immunity is going to take longer to develop. But the good thing about this virus is that everyone with this virus is not dying the way it's. If you really see the number all over the world compared to what have been infected, also not so much.
Right.
So even if you take 2 to 6%, if you say 2 to 3%, that's very low. If you take 6%, 8%, even that is comparatively low compared to the number of people who actually get affected.
True.
So the
True.
most important thing is not to panic.
Hmm.
Um, Everybody should actually have a family practitioner. So this, if not, this is the time to connect with one somehow. And
Right.
if there's any doubt, always run it past them.
Right. One more question connected to your panic comment as well. There's a lot of apprehension amongst those patients who have come for follow-up. Can you please give your thoughts on that so they can be more reassured?
Well,
Who
people
have
are
to
coming.
come for follow-up? Sorry.
Well, yes. Number one, because we are in a lockdown,
Hmm.
we must minimize follow-ups.
Right.
Just like I'm talking to you just now on Facebook or on Zoom, today it's
Hmm.
possible to do consultations with the doctor, even on the phone if there's a doubt.
Right.
But routine follow-up. So let's say you've been treated for cancer 2 years ago. You're
Right.
absolutely asymptomatic. You're normal. There is no need for you to rush in for a follow-up visit just because you're 3 or 4 months or 5 months ago. If you're
Right.
well and you're asymptomatic, the chances are you're just generally extremely normal. So you can wait for things to improve.
So
If you
would you
feel you
advise them to contact the doctor and, have a
absolutely
chat?
yes, that's right, and have a chat or just ask the doctor whether you need to come in. The
Hmm.
doctor will say, well, you're fine. You can come in a little later when
Right.
things settle down, and there's no harm if it's a routine appointment after 4 months. If the person goes after, let's say, 5.5, 6 months, it's not going to make any difference.
Right. Right. Okay. Um, I'm just checking if there's any more questions. I think you've answered a lot of questions already. Um, just giving people a minute. In the meantime, I think I'll just share what we have put together as some of the resources that people can use. Hang on. So one of the things while we are waiting for if there are any other questions, we found a couple of things that work based on our experience. And as doctor said, confirm your appointment with the doctor before you go, carry your prescription, letter from the hospital, IDs. If you're the caregiver, yours and the patient's. Some places we've heard like Gurgaon are also giving caregiver passes. There are groups that are being formed. There's Caremongers, there's Project Mumbai, etc., who are supporting for transport and medication. Reach out to neighbors, reach out to volunteer groups. We are putting up the list later today on our resources page. There's also a link we'll add to the notes on 18 practical tips for safe hygienic practices for cancer patients at home. And I think, okay, so one other question that's come up, doctor, is on what about newly diagnosed cases? I don't know what.
Yes, no, I think I know what, because I also have, as I said, I've got 8 patients just waiting just now.
Right.
These are newly diagnosed and they are so anxious.
Mm,
And as much as possible, I feel that these should relatively be treated as soon as possible. And the treatment all depends. Um, for example, there will be some in which you can delay treatment. For example, if you have a breast cancer patient who's something
mm,
called estrogen receptor positive, then we have a choice of putting them on an anti-estrogenic tablet for a month, 2 months, even sometimes 3 months, especially if they're post-menopausal.
right.
And so we can delay. So it all
Right.
depends on whether certain treatments can be delayed. A certain treatment, you give some drug treatment which allows you a window period of delay.
Right.
Not, I think the hospital administrations and the doctors have to come to some terms to, because as I said, these are semi-emergencies,
Mm,
and they need really to, one needs to start
right.
treating them relatively soon. In fact,
Right.
in a couple of our hospitals, we have been having these discussions all the time. One of my colleagues has just sent an email round asking that what are we doing? We need to come to a consensus and get on, which is absolutely correct. I mean,
Right.
we need to, I feel cancers, heart, if you have a heart attack today, you can't stop it. You sit at home and say, oh, there's a lockdown, I can't get treated. You need to get treated.
Right.
On one side, you have a disease or a medical problem in which your mortality will increase if you're not treated at the opportune time.
Right.
On the other side, you have a virus which may or may not kill you. I mean, the
Mm,
chances of dying from the virus are low.
right.
So it has to be reasonable. The problem the hospitals are facing is also staffing. Because of
Mm,
the transport lockdown, nurses and others are not able to come.
right.
Then
Right.
there'll be questions: how often can you screen them? All
Mm,
these sort of questions come up. Screening, even the kits were not available for some. They've just
right.
become recently available. So I understand the hospital's problems. Plus, the government has told them that you must keep all your intensive care beds
Right.
uh, for these
Available.
patients.
Correct.
So on one hand, patients' routine elective surgeries, which will occupy a lot of time in the intensive care, they are likely to get delayed a little more till
Right.
till there is some more understanding about this problem. Today we don't. The problem is we don't know what numbers we're going to face next week.
Right.
So
Right.
that's where the problem of the hospital comes from.
Mm,
Secondly, the other problem was, of course, the doctors and nurses and everybody who's involved, healthcare workers are themselves likely to get exposed. So we have to decrease the number of people coming in.
right. Right.
And being short staffed, you have to still provide the service.
Correct.
So these are problems which are being sorted.
Right.
But yes, I think as far as the principle goes, I believe cancer cannot wait.
Right.
So beyond a certain days, people who have been newly diagnosed, we need to somehow get on and treat them. And we
Right.
must come to some sort of understanding.
But they shouldn't rush to Mumbai, until they get appointments and stuff like that, right?
No,
So,
no, until it's
and
very well
anyway,
planned.
they can't
This has to be
anyway
well planned.
travel, but right.
Yeah. this has to be well planned. I mean, this is not something one can do ad hoc as we used to.
Right. Okay, a couple of other points have come up. Are oncologists practicing telemedicine, especially for, actually, it could be, this is for end stage cancer, but I guess it could be for any stage cancer patients.
Well, telemedicine had never taken off, but I believe this sort of an episode is something which will force it to take off.
Hmm.
So, yes, it all depends upon their consultant.
Right.
That, and I was, for example, I was just discussing with my junior today. We reviewed all the patients that we are treating,
Hmm.
where they are in their treatment cycle, and the
Right.
ones who are waiting. And on Monday, we thought that we would actually talk to each of them together on something like Zoom or one of these platforms and actually speak to them face to face. So
Right.
telemedicine is going to come up,
Right.
and
Right.
if you have a consultant who's willing to do it, the problem is legally he needs to maintain records.
Okay.
You see, there is also a huge legal aspect to medicine today,
Hmm.
which we cannot just turn ourselves blind to.
Right.
So one needs to make records of these.
Right. Right.
So there is a system which the medical council is suggesting for advice, which is even given on WhatsApp today.
Right. Right. Understand. Yeah.
So,
And I guess uh, they could still consult using telemedicine for second opinions and things like that,
of
right?
course, yeah,
Right.
that's been done.
Okay. And one other point which Vandana is asking is some people are being given advice that earlier doctors were over treating them. So please say something to put this fear at rest.
Sorry, I didn't get that.
Says some people are being given advice that that earlier doctors were over treating them.
This is something Uh, well, there are 2 points actually. One is there can be differences of opinion between two super specialists
Right.
about treatment, and to make a statement that you're being overtreated is not very it's not simple actually. So in
Mm,
each case, one has to see whether the treatments can that
right.
treatment be stopped or not. I mean, and they can become an opinion between two different consultants.
Right. Right. Okay, thanks. I think there were a couple of questions which were not related to COVID-19, so we're not really going into them. And I think we've kind of taken up a lot of time of Dr. Deshmane. And I'll just kind of put up again just our final slide. And thank you, Doctor, for taking the time. And just for everybody, be responsible, stay at home, and we'll put up the links, etc., after this as well, and reduce the load on doctors and nurses. Ask for help if you're feeling anxious, and I also offer to help. One of the things we've heard of consistently over the last week is that there's shortage in the blood banks as well. So be open to donating blood, and
Mhm.
be creative and exercise at home as well. Thank you, Dr.
Yeah.
Deshmane, for taking this time.
Thank you, Aparna. Thank you very much.